Hello, my name is Hannah Glass, and I am a student nurse with Delaware Technical Community College. I have you here today so that I can teach you about kidney transplants and what you need to do as a nurse pre-op and post-op. So first of all, what is a kidney transplant? A kidney transplant is a surgical procedure that uses a healthy kidney from a living or deceased donor and places the kidney in a client with kidneys that are no longer functioning. Now, some assessment findings that you will expect in a client that needs a kidney transplant. You're going to see them coming in and presenting with symptoms of fluid overload, so they might be hypertensive. There could be heart failure, edema, pulmonary edema, crackles. They might have olguria, so they're going to have less than 30 milliliters an hour of urinary output. They're going to have signs and symptoms of toxins built up in their body, such as uremic gastritis, stomitis, nausea and vomiting. They're going to have increase in their electrolytes. So there may be issues neurologically as well, including tremors, jerky movements, ataxia, decreased level of consciousness, seizures, lethargy, and even possibly coma and death. A very important lab that you need to realize as a nurse is your glomerular filtration rate, or your GFR. Your GFR in a client that is end-stage renal disease is going to be 15 or less milliliters a minute. And our end-stage renal disease patients are going to be our patients that are getting these kidney transplants. It is also important to monitor this throughout treatment because it allows you to see how well that new kidney is functioning. So these patients are going to have a decreased GFR, a decreased hemoglobin, decreased hematocrit, decreased red blood cell count, calcium, and possibly metabolic acidosis. Their creatinine and BUN are going to increase because their body is not able to get rid of those things. They're also going to have an increase in potassium, magnesium, and phosphorus. So as a nurse, you need to be asking yourself, does my patient have a good probability of transplant success? When it comes to success from a transplant, you need to have a patient that is willing to take care of their body and themselves and is going to be compliant with the medications that they're going to be taking. You're going to want to make sure this patient does not have any active cancer, is not currently abusing drugs or alcohol, no severe cardiac or peripheral vascular disease, no active or uncontrolled psychiatric disorders, no documented history of medical incompliance without reasonable justification, no severe pulmonary hypertension, and no BMI of 35 or more. And if they have a modifiable contraindication, you can give them teaching so that they can eventually qualify for a kidney. The donor must also be healthy because you're taking the kidney out of their body, so that puts them at risk for other things as well. You're going to want to make sure they don't have any acute infections, no uncontrolled hypertension, diabetes, or cancer. And regardless if it's a living or deceased donor, you're going to want to make sure they had normal kidney function. You're also going to want to make sure that you're not putting the recipient at risk. So you're not going to want to give the recipient a kidney from a person that has HIV or hepatitis. So some preoperative nursing care that you need to be aware of. These patients are going to be getting immunosuppressants and monoclonal antibodies to help prevent rejection of that new kidney. So they're also going to be getting prophylactic antibiotics. So you really need to monitor them for signs of infection and make sure they're adherent at taking these medications. They're going to continue dialysis until their surgery to prevent buildup of uremia. So teaching is really important, and we'll get into that a little bit further down in the slides, but you need to know that you need to be able to answer all of their questions and make sure they understand the procedure, and you're always, always, always going to make sure that you witness signed consent. Post-op, you're going to want to take your vital signs every 15 minutes and then every hour as per protocol. Assessing your urinary output is going to be really important because this is going to give you a good indication of how well that new kidney is doing. It is normal to see pink or bloody urinary output after the surgery. And you're also going to want to make sure that you're getting 30 milliliters an hour of more of urinary output. And it is very important that if that stops or decreases, that you notify the healthcare provider immediately, because this is a sign of possible rejection. You also need to assess the need for bladder training, because most of these patients getting kidney transplants have been on dialysis for a long time, so they haven't been using their bladder like a normal person would, and you can suspect that they're going to have some bladder atrophy. So about 2 to 3 days after we have this surgery, we're going to take that indwelling catheter out, and we're going to give them intermediate catheterizations. You're also going to want to make sure you're performing metrition and anything else that can help to have that bladder up and going. So you're also going to want to assess your surgical site, because a bloody surgical site is indicative of a hematoma of a hemorrhage, and we need to let the healthcare provider know immediately. So some things you need to do post-op: you're going to want to do your daily weights to monitor that fluid. You're monitoring your fluid and your electrolytes, monitoring for signs of infection, monitoring for signs of rejection, and this includes fever, really strong pain at that site, or decreased urinary output. You're also going to want to administer your IV fluids, because we're going to really want to make sure that these patients are going into diuresis. You're going to give them oral fluids as soon as their bowel sounds return to normal, which it's normal for bowel sounds to be slow after surgery. You're going to want to prevent atelectasis and pneumonia by turning them every 2 hours, having them cough, having them use that spirometer. Catheter care is very important, because remember, these patients are immunocompromised, so you're going to want to prevent infection. You want to clean that catheter. You're going to administer your immunosuppressives, your stool softeners, to help get things up and going. You're going to want to refer these patients to possible support groups. They're going to have consultations with a urologist, because they're going to be getting regular checkups on their GFR rate and their BUN and their creatinine for the rest of their life, and why they have this kidney. So you're also going to want to arrange for those post-transplant follow-ups as well. Some possible nursing diagnoses that you need to think of is risk for infection. Remember, they're immunocompromised. Urinary retention, if that kidney does not pick up like it should. Readiness for enhanced knowledge, because their life is going to be very different now, and they're going to have a very set of rules that they need to follow in order to keep this new kidney functioning and working properly like it should. They may have acute pain, so you're going to want to take care of that. They are at risk for ineffective renal perfusion, imbalanced fluid volume, and electrolyte imbalance, just because they all have that risk for possible kidney rejection. So it's very important that we monitor the fluid levels and the urinary output and those electrolytes. So what do we really want to ensure for our patients? Well, we want to ensure that our patients have hemostasis with their electrolytes and their fluid. We want to prevent rejection of that new kidney. We want to prevent infection. So implementation, some things that you can do for that is you're going to do your urinalysis, your daily weights, your fluid and electrolytes, monitor for manifestations of infection. Excessive diuresis is also something that you need to be concerned about. You're going to administer oral fluids once as possible, your urinary catheter care, diuretics, immunosuppressives, and stool softeners. And teaching is going to be very important. So we're going to do a lot of teaching on medications and diet and manifestations of complications, and we'll get into that in a minute. So patient teaching. When it comes to medications, you need to really make sure that they understand that they're going to be taking these immunosuppressives for the rest of their life. They're never to stop these immunosuppressants. Not only will it promote rejection of that kidney, but it can also put them in adrenal crisis, because we're also giving steroids along with these immunosuppressants. It's part of the regimen. You're going to want them to monitor for increased blood pressure, monitor for respiratory changes. Avoid grapefruit juice with cyclosporin because grapefruit juice will inhibit the ability for cyclosporin to be metabolized. You're also going to promote them to take magnesium while taking cyclosporin because cyclosporin can lower magnesium levels. You're also going to want them to monitor their sodium levels when they're taking prednisone, but as I'm about to explain to you, you want to monitor sodium, period. They're going to get a low-fat diet, high-fiber diet, increased protein. Low sodium is very important because we want to make sure that they are never hypertensive. If they are hypertensive, this puts them at risk for damaging that new kidney. We want to teach them the importance of adherence, that the life of their kidney could be up to 15 years as long as they take care of it like they're supposed to. Avoid smoking, alcohol, and avoid contact sports because we do not want to damage that new kidney. So a possibility is organ rejection. We have 3 kinds. There's hyperactive, acute, and chronic. Hyperactive occurs within 48 hours of surgery and requires immediate removal of the kidney. And this is where you're going to have your fever and your pain and decreased urinary output. Acute can occur within weeks, and we can monitor this through urinary output and glomerular filtration rate. And what we're going to do for these people is we're going to increase their immunosuppressives. Chronic rejection occurs from months to years, and that's just from the normal fibrotic tissue that's replacing this donor tissue. And we're just going to continue our conservative measures and continue our immunosuppressants so that we can slow this down. You're going to diagnose these through looking at your ammonia levels in your blood, fluid retention, your electrolyte imbalances, fatigue, and you're also going to want to do a kidney scan or kidney biopsy in order to take a look at how those kidneys are doing. So something that we really need to be thinking about in today's age is our global pandemic because we have patients that are currently immunocompromised. So a study that I found, I thought was very interesting, very informative, showed that a bunch of patients that had a kidney transplant came in, they had COVID, they had to have their immunosuppressants decreased and given antivirals and immunoglobulins to try to treat this COVID-19 infection, and the overall result is that we had a 21.1% mortality rate with these patients. And that is alarmingly high considering only 0.6% of people that get COVID nationally end up passing away. So the conclusion from this is that we really need to be promoting that infection prevention. They needed more patients in this study and more time because this is something that has just happened, but looking at these numbers alone, you can just see how alarming that number is. So it's very important that we are breaking the chain of infection and that we are preventing from infection for these patients. So you're going to want to do your spirometer as soon as they get out of surgery, up-to-date vaccines, yearly flu vaccines, their prophylactic antibiotics post-op. You're going to want to teach them to do frequent hand washing, be very sterile with the catheter. You want to teach them food safety, wearing masks when they're out in public, and just basically you're going to want to teach them to be very cautious. And that is all I have for you guys. If you have any extra time and you would like to test your knowledge on what I taught you, I have attached on this PowerPoint 3 extra questions for you guys to test your knowledge. And I hope this helped. Thank you.